Hello, everyone. This is Dr. Richard Fleming. Today is Saturday, September 19, 2020. To my Jewish friends and colleagues, Rosh Hashanah. To the family and friends of Ruth Bader Ginsburg, I express my deepest sympathies and condolences. This week was again marked by multiple changes in the CDC, NIH, FDA, HHS, flip-flopping on decision-making in COVID-19, demonstrating yet again a complete lack of consistency in recommendations. This most recent one with the flip-flopping of whether asymptomatic individuals should be screened or not for COVID-19. This inconsistency points to the arguments going on between scientific and political factions and the loss of scientific integrity for addressing COVID-19. The general public has declared a concern over the development of vaccines, as has the scientific community. That concern is focused on demonstrating the safety and efficacy of these vaccines and the trials that people are being placed in for them. That same safety and efficacy, however, must be considered for the treatment of drugs with COVID-19. We've completed the initial steps of our clinical trial and have started to unmask some of the information about COVID-19 and its treatment. That information is very telling about which drugs seem to work and which ones do not work as well, or at least as well under which circumstances. About a week ago, I proposed that we initiate a study in the outpatient setting for people who believe that we've been masked and shut down for way too long and that there are drugs that are available, such as hydroxychloroquine and zinc and azithromycin, which would benefit patients. For all the physicians that have taken to social media and gotten their 15 minutes of attention, I encourage you now to do something more than this just initial lighting of a fire. I encourage you to come forward and participate in something larger than yourself in the interest of people concerned about treating COVID everywhere, in the United States and throughout the world. Participation in this study will give you an opportunity to demonstrate some safety and efficacy of these anecdotal treatments that you're currently prescribing, where you can validly criticize individuals for not having the types of scientific studies that have been necessary to provide treatment recommendations, particularly in the outpatient setting. You cannot criticize those same individuals if you yourself are not willing to participate in the collection of this type of information. Remember, if you're a physician or a scientist involved in treatment of COVID and you know or you believe that what you're telling patients is true and correct, you have a moral and ethical obligation to demonstrate that. What better way to address the problems of COVID than to be part of the answer and solution? Much more fundamentally satisfying than just simply criticizing others for not providing the types of studies that you think that they should do. Be part of the answer. There's an awful lot of interest in social media by people that want to criticize everybody these days. It's very easy to do on social media, particularly if you can do it anonymously. It's very easy to become the problem and not the solution. So for all of you right now that believe that you understand how to treat patients with COVID-19, particularly in the outpatient setting, I encourage you, I implore you to be part of the solution. Let me know that you'd like to be a part of the study. I'll provide you the information for what we're recommending that people do. And you too can be part of the solution instead of part of the problem. Your failure to participate in such a study is somewhat evidence of the fact that you're not that confident in what you're saying. And that raises all sorts of ethical questions about whether you should be out there telling people that they should be taking certain drugs or treatments for COVID 19. Today is the 19th of September 2020. There's still several weeks before the 1st of October when I'm calling for this COVID Independence Day trial. Please be part of this solution and not part of the problem. I look forward to hearing from you, and when all is said and done, sharing the information that's obtained together so that people can become more aware of the treatment options